Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today we're going to be talking about heart health. There's been a lot of discussions recently in the media about heart health, and I do believe this is because of a few notable Australians who have recently passed away because of heart attacks in their 50s. Whilst it's in the headlines right now, GPs have been managing heart health, your risk factors, and the after having a heart attack part for decades now, if not longer than that. Every day, 21 Australians will die because of a heart attack, and every 9 minutes an Australian is admitted to hospital because of a heart attack. So let's break it down together. So let's start with the simple thing. What is a heart attack? A heart attack is when the heart muscle dies because of a lack of blood flow and oxygen. The heart has its own circulation, known as the coronary arteries, and if these are blocked or otherwise compromised, then a heart attack ensues. If enough of the cardiac muscle is compromised and dies, then the heart tissue won't actually be able to pump and function. When these arteries are closed off, there is a small period of time in which circulation may be restored and you may be able to save the heart tissue. In medicine, there is a saying, time is tissue, and this is why acknowledging signs and symptoms of a heart attack sooner rather than later may very well save your life and save your heart tissue. The most common reason for a heart attack and the reasons that the coronary arteries block off circulation is because of plaque buildup. Plaque is essentially cholesterol, fats, and minerals like calcium, which accumulate within blood vessels, mainly arteries, all over the body, but obviously most detrimentally around the heart. Having plaque in the vessels isn't just a narrowing thing, it also weakens the tissues of the vessels themselves, making it really dangerous. Plaque is also unstable, so it can break off, and when it breaks off, it forms a clot, essentially an embolus, which can travel off, and if it blocks off the arteries to the heart, it can cause a heart attack. It can also, just so you know, cause a stroke if it blocks off any of the major arteries or the arteries around the brain. Heart attacks rarely happen for no reason out of the blue, although some can, but the majority don't. A person who has a heart attack often has had several warning signs or has several risk factors which could have been modified. And this isn't to put blame on people who have had heart attacks, not at all. It's just to educate you that there are things you can do to reduce your risk of having a heart attack. The most common and the most important risk factor is smoking. If you smoke, you increase your risk of a heart attack exponentially because it weakens those vessels and it increases the likelihood of plaque formation. Other really common and really significant risk factors include high blood pressure and a family history of heart problems. The average age for heart disease and heart attacks in males is the 50s, and for females is the 60s. So age and gender do also play a part in your risk factors, and clearly you can't modify those. When we start breaking down the risk factors of blood pressure and cholesterol, we can see a couple of other things that influence heart health too. For example, leading an inactive lifestyle increases your risk of blood pressure, high cholesterol, and therefore heart attack, as does having a diet that isn't filled with an abundance of nutritious foods. Every little bit counts. Stress also greatly impacts on heart health, not only because of the hormones related to stress, but when we're stressed, we tend to not make good lifestyle choices. We tend to drink more, we tend to exercise less, and we tend to not eat as well. This is why we GPs get tied up in the details, why we're always asking you if we can check your blood pressure, about your smoking habits, about your drinking habits, about your lifestyle habits. It's not because we want to call you out or feel superior or anything like that. It's because it all matters. And if we can decrease your risk even a tiny bit, we will. Early recognition of a heart attack, like I've said, may save your life. We hear and see in the media very commonly this representation of heart attacks being when someone clutches at their chest and gasps and can't breathe and then collapses, and that's a heart attack. But that's not always the case. Heart attack signs can be varied from a pressure in the chest, increased reflux or indigestion, feeling like something is squeezing your chest, not being able to get a good breath in, pain that radiates up the jaw and down the arm, an ache in the chest, feeling dizzy, lightheaded and sweaty, feeling like you're going to throw up or faint, and sometimes just breaking into a cold sweat. The pain may last a few minutes, or it may come and go, or it may be consistent. Some people get no warning signs. Some people will have symptoms and then learn years later that they actually had a heart attack at that time. Some people will have no symptoms and learn at a later date they've had a heart attack. We in the medical profession can diagnose heart attacks via an ECG, an electrocardiogram, to look at the way that your heart is beating and conducting electricity. We can also do blood tests to look at the enzymes that your heart releases under duress, such as troponin. Sometimes we may do an angiogram, that is, looking at the blood vessels around the heart, to identify what percentage of the blood vessels are blocked and what percentage of the heart tissue has been lost. Treatments for heart attacks will vary depending on your needs, obviously. They may include medications at the time to break up any emboli or clots. It may include surgery to remove that clot, to insert a stent to make sure the blood vessel isn't collapsed anymore but can open up and give you blood flow. It may involve what we call cabbage, which sounds like the vegetable. I promise it's not. It's a coronary artery bypass graft in which we create a new circulation for you so the heart tissue still gets blood flow. After a heart attack, we will talk to you about medications to significantly reduce your risk of having another one in the future. This may include blood pressure medications, cholesterol medications, and blood thinners, even if your blood pressure is fine and your cholesterol isn't high. This, of course, is very individualized, so I won't go into detail because your cardiac cocktail, as it was, will vary greatly depending on your needs. I've spoken a lot about how plaque and cholesterol and all of that can cause heart attacks, but I do want to acknowledge that it's not always the case. Sometimes the blood vessels around the heart dissect spontaneously and burst, and the blood flow is compromised that way. Sometimes it's because those arteries spasm, and so there is inconsistent blood flow to the heart muscle itself, or no blood flow to the heart muscle itself. And finally, I wanted to talk to you about the difference between a heart attack and a cardiac arrest. We've already touched base on what a heart attack is. It's the compromise of the blood flow to the heart, causing death of the cardiac tissue, whilst a cardiac arrest is when the muscle stops beating, usually due to an electrical malfunction. Mind you, heart attack can and sometimes does lead to a coronary or a cardiac arrest, but they are two separate things. I'm happy to break this down another day if you'd like more detail. If I could leave you with any suggestions, the biggest thing you can do for your heart health is to stop smoking if you're smoking. If you're not smoking, the next best thing you can do is take at least 30 minutes a day to look after yourself. And I know self-care is washed with privilege and people who have time, and I understand that. But if you could take 30 minutes to do some exercise, to make nutritious meals, to de-stress or reduce your stress, you'd be giving yourself a better chance of not having a heart attack in the future. If I could write you a script for 30 minutes of self-care a day, I would. Unfortunately, it's not that easy. But that's going to do it for this time, guys. Don't forget to like, subscribe, and comment. Give me suggestions for videos you'd like me to cover in the future. But until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.